Okay guys, so in this video we will be discussing about the dumping syndrome. So what is a dumping syndrome? It basically occurs when food, especially sugary food, will move too quickly from the gastric region to the intestine. So it's going to directly enter into the intestine without getting processed in the stomach. Why does that happen? Usually in people who have gone through the surgeries like gastric bypass or even gastrectomy. Okay, so there are two kind of symptoms. They're going to be first early dumping symptoms and then the late dumping symptoms as well. In first 10 to 30 minutes after the eating, what happens is that hyperosmolar food will move from this gastric content to the intestine. I'm now being hyperosmolar, which means it has a lot of solute. So imagine this being the intestinal lumen and now having a lot of solute here, and in the surrounding region are the blood vessels. Water from the blood vessels, from the blood, is going to get attracted toward this solute because of osmosis, and large amount of water is going to be present within the intestine. Now because of this, there's going to be low blood volume and intestine is going to actually get distended. So there's going to be distension of the intestine. The symptoms would be abdominal cramps, bloating, diarrhea, nausea, palpitations, excessive sweating, dizziness, and flushing. Why it happens? Again, because of the fluid shift from the blood to the intestine. So you can appreciate here that how water is actually entering from the blood vessels surrounding the intestine into the intestinal lumen. Now, after this, there's going to be a late dumping syndrome, which occurs after 1 to 3 hours of eating. So this was within the 10 to 30 minutes, and then after that it's going to be 1 to 3 hours for the late one. So rapid glucose absorption is going to lead a large amount of insulin release from the pancreas. So now because of the glucose content in the intestine, it's going to stimulate the pancreas to release large amount of insulin into the duodenum. Because of what's going to happen, there's going to be reactive hypoglycemia. So early dumping was because of the fluid shift. Late dumping is going to be because of the insulin surge leading to hypoglycemia symptoms. So what happens is there's going to be weakness, hunger, tremor, sweating, palpitation, and also confusion. How are you going to manage that? Eat small, frequent meals. Avoid taking sugary foods and also drink. Increase protein and fiber. Drink fluids between the meals, not with the meals. Okay. So in severe cases, you can also take octreotide, which is a somatostatin analog that's going to decrease the production of insulin over here. So yeah, that's it for the dumping syndrome. I hope it helped you.